live stream of the National Reentry Resource Center's Grantees Intensive Training Series, and we are at the Council of State Governments Justice Center office in New York City. And today in the room we have grantees from the Second Chance Act Adult Demonstration Program, as well as Technology and Careers. The National Reentry Resource Center will be hosting 4 more of these training series, so just please stay tuned for announcements. And for those of you that are joining us live stream, please feel free to type in your questions, and Bonnie will relay that to the audience. And we will also be looking to you here in the room to ask questions along the way. So today's session is about using data to measure your impact and improve practices. And I have a great group of presenters here, and I'm really excited for all of you about the presentation that they're going to be giving. And all of the presenters here have actually participated in an adult demonstration program. So Sunita Singh will be starting us off. She is the Research and Evaluation Coordinator for the Louisiana Department of Public Safety and Corrections. And then our next 2 presenters actually worked in the same project, so I'm really excited to hear the evaluator's standpoint as well as the practitioner's standpoint on the same project. So Dr. Melissa Neiman, who is the independent consultant and evaluator for the city of Lowell, Massachusetts, and Tracy Jackson is the LEAP Reentry Manager for the Lowell Police Department. Before we get into the presentation, I want to I want to bring us back to the charge that Andre Benthia gave early this morning from BJA. And that is that we are supposed to use the data to demonstrate your progress effectively and support operational success. And that is nicely woven into the solicitation that the adult demonstration grantees responded to, that you would provide an independent evaluation. Extent possible, that you would use random assignment and a control group. And we'll talk a little bit about some of the challenges related to that and what that could look like. And at the same time, your research partners should be really woven into your program. They're not an afterthought, that you actually give them access to agency data, interview personnel, and monitor operations. The adult demonstration grantees have also signed up to cooperate in the research efforts and program evaluations and provide detailed individual level data and implement random assignment and other modes of participant assignment required to the evaluation design. So sorry for some stumbling right there, but with that, I'm going to turn over to Sunita, who's going to start us off talking about approaching a reentry evaluation. There you go.
How are you guys today?
Good.
Good. Microphone.
You can use it.
Microphone on. So how should I?
You can take it off the
You
stand.
should either stand or something. Okay. This is my American Idol stance. All right. So first off, I'm from New Orleans. We're quite friendly there. So I want a big, how you doing, baby? That's right, that's right. I want you to feel very comfortable while I drag you through my nerddom, okay? All right, but essentially what we want to do is make you feel empowered in the process of evaluation. This has to come from you. You guys came here for a reason, and honestly, the work we're doing is so important. And we want to do it well, but we also want to do it from an evidence base and make sure that we're doing it properly as we move along. And that's really kind of the point. So let's talk about why do I click you? Do I click you? Or do I click the actual clicker part? Huh. Okay. So first let's talk about how we're gonna do this, so how we're gonna move through these ideas. And the point is not to confuse you. The point is to take this slowly and easily, hit us with these questions at the end, and we're here to serve you, to make this process more digestible, right? So we're gonna break it down. We're gonna talk about developing an evaluation plan, how you get started, what kinds of questions to ask, and layering your approach for an evaluation. Okay, why would you evaluate? right? I told you it's going to be nerdy. All right, now it sends a message. I'm going to have to send a quick shout out to my colleagues at the Department of Public Safety and Corrections in Louisiana. It was the leadership that said, look, we want to make sure we're doing a good job. We want to make sure our money is going in the direction that our clients are going in. And the message of doing an evaluation is very loud and clear. It means that you value evidence and that you're willing, at least, to question what you're doing. How many times have you done a program for how many years and you find the same recidivism over and over again? And so the evaluation gives you the opportunity and the platform to say, well, what's going on? What could be going wrong? Who is your audience? So your audience will be each other to a certain degree. Hey, this is working, let's keep going with it. But also your funding bodies, they want to see that you're using your money well. They want to see that you're using your efforts well, and this is a way to demonstrate that. The other thing is your policymakers. So say you found a cost savings or a way to operate that's more efficient. How do you show that? You've got to have some data. You've got to have some proof. So that's really important to be able to say that. And then there's academics that can put that literature out into the world, and that information can then go into an evidence base, and then it can become practice for a number of people. So this is an important piece. And the purpose of an evaluation is basically what I'm saying. It helps you determine which strategies are best for you and what's most sustainable. So that's something that you guys will find in your solicitations. You want to be able to say, we found something and we built it into our program. And now we don't need extra money for it. Now it's a part of how we operate. Okay, so how would you get started? And I'm going to say that what worked in Louisiana was high-level buy-in, having leadership at the top say, guess what? I like these priorities. I like where you're going with this. I may not know exactly how to do it, but let's start down this pathway. And so having the leadership of probation and parole, the leadership of the Department of Public Safety, all of our research teams had the same goal. We wanted to see what was working. We tried a new strategy with some of the grant money, and then we wanted to say, okay, this strategy worked. One of the biggest problems was the practitioners and getting practitioners to say, okay, I'll do this with you, I'll go on this journey. And that wasn't always easy because of reasons we're going to talk about. But if you get that buy-in and you get data extraction, I'm going to use my little pointer. Hey, can you see my pointer? Okay, I don't see it. Right, it is. Okay, your data extractors, they needed to understand what your vision was too. So I really was watching your faces when Nicole said evaluation is an afterthought, because really the most powerful time to have your evaluator in is in the very beginning. That is the most important time. And things that we troubleshoot when we meet. So you see up here, nobody wants to meet all the time. How many of you want to meet all the time? You usually end up wanting to kind of hurt someone if you meet them all the time. But what do you call it? Norming, storming? Lots of that. Lots of that. And when you get that, after a while, you all are on the same page. So having that frequency of meetings was important. So we did bi-monthly. And what did we do during that time? We understood how we operated. So sometimes we'll get in our silos. We don't even really know how each other works. And that's an issue. So Day Reporting Center wasn't really clear on what probation and parole. You get the after effect, you get the data piece, but you don't know how it works. We looked at what kind of data does everybody generate? What's the timeline for that data? How often are you able to tell me when someone recidivates? How often are you able to tell me when they're arrested and they're pending charges, but they're not actually in your system or in mine? These were very important in evaluating over time. And these guys are going to get into that with great detail. Also, is your project operating as you planned it? So you have an innovation or you have a grant cycle that you're doing a program. Well, is it actually happening? So we had problems where there were backups, there were bottlenecks, and people weren't being referred all the way through in the same timely manner as we had proposed. And guess where we found that out? At these meetings. So very important. And how is your dosage? So the dosage of your intervention, what do I mean by that? We're going to talk about it a little bit more, but how your dosage is determined there needs to be consensus about that. People need to understand how we feel about it. Okay, so an evaluation is driven by questions. You're asking questions. And right now I want you guys to start asking questions about your own programs, right? We want to keep this very general. We don't want to talk about anybody's specific program yet. We'll do that in the breakout sessions. But right now, let's talk about, in your mind, what kind of questions do you have? Now, this idea of formative versus summative questions. In the very beginning, you guys did a strategic planning session where you already assessed your needs. You've already assessed what needs to be addressed in your program, right? So you've answered some of these early beginning questions. So as you get into implementing your program, then you've got questions about, well, am I operating as I plan to operate? And sometimes we call that model fidelity, right? You built a model, are you staying true to the model? And then you've got your outcomes, but you have different types of outcomes, and they come at different times, right? So here you've got your outcome evaluation, and then impact is further down the line. It's, did we make the kind of change that we hope to make? You're not going to find that out in the beginning, right? You need some time to kind of push that through. All right, working within pluralism. I can just say, as an evaluator, I really had to learn over time. It was not instantaneous. I had to really have deep down conversations with all of our partners to find out what is it they want. And if you were to define every player in your grant right now, can you tell me what they all want? So, Louisiana Department of Public Safety and Corrections, I found out that their priority, A, was to reduce recidivism, of course, that's all of our priority, but they needed to be able to do it with a cost savings, because how else could they push it upstairs, right? So, all right, I've got to think about this in terms of my evaluation. Probation and parole wanted to make sure that they were doing the best job at breaking down risk, needs, and responsivity, although we didn't call it that at the time. They wanted to make sure that the right treatment was going to the right risk group. Well, how do I tell that? How do I know that? And why is that important to me? Because if I can put that in my evaluation, I've got their full buy-in, right? Now, also the Day Reporting Center, they needed validation that their model was working. Here they're getting all this money, well, where's the data? Who's gonna help us put the data together to show that the Day Reporting Center is working? So these are they're not just, how did the program work, right? These are very deep questions. Ha ha. All right, also, within our deep questions, we have sub-questions. Part of doing a program and getting it right is to be able to say, am I looking at the right people? So what did you guys learn today with R&R? Your higher risk group, if you put your programs in on that group, that's where you'll see the most change. Lower risk groups don't need as much dosage, so on and so forth. So we made a deliberate effort to make sure we were targeting higher risk people, confirmed gang members, people who had had a long history of juvenile offenses and later offenses, people with offenses, specifically 3 or more arrests of crime of violence, drug, and gun charges, and so on. So we were very clear on who was eligible. Now, this is a fun slide. This is where you guys get imaginative. This is where it's important to have good conversations with your people. What are each of your partners' underlying assumptions? And how do they believe their program is going to work? Have you ever thought about it? Sometimes you would hear their underlying assumptions and be like, why do you even think that? Right? it's important to have some conversation and say, this is what I think will work. So probation and parole believed that, and let me talk about our strategy very briefly. What we did was we enhanced supervision by increasing the amount of touches or contacts our probation officers had with their clients. We improved our probation and parole officers by training them on motivational interviewing. They also had some interaction with cognitive behavioral therapy or treatment. And we also came and tried to front load services with the day reporting center. So we shunted all of our highest risk people through the day reporting center so they would get their social services met, their mental health issues met, but they were also getting more probation and parole supervision. Now, PNP's theory was, I'm going to deter crime by detecting more of it, right? Is that a correct assumption? Do you believe that? The more I watch you, you're going to stop your criminal activity. What was that? I didn't do anything, right? Okay. So the day reporting center's theory was that if I help you right off the bat take care of your big needs, that you're going to be okay and it's going to decrease your recidivism. A blended version of theory is that, okay, the highest risk people are going to get detected and arrested right off the bat, and all of the people who really need help, that got help, that's going to decrease their recidivism. And a null hypothesis is extremely important because the null hypothesis is this is bull. Everything that you thought of is bull, and there's another way that this could happen. And that's essentially that people play probation until probation is over, and then they go back to their behavior. All right, now, how do you prove your hypotheses? You have to come up with some data points. So we did assessments of risks and needs and responsivity. And we actually started looking at which treatments meet those risks and needs, right? We, stratified our dosage for those pieces. And then we had to take data on all of our treatments. How many probation and parole officer visits did you have? How many classes in the DRC did you have? How many services did they give you over time? Now, we don't want to overwhelm you, and the data team, these lovely ladies are really going to get into how you explore this and make it make a lot of sense to you. But it's important to think through what is going to prove your question. What's going to answer your question for you? Now, finally, do you have a comparison group to look at the change? And that's sometimes it's difficult to do. Sometimes it's expensive, it's time expensive. It's actually expensive because you have to track that data. But it's very important to say, did my effort actually make a significant change? All right, so this is an example. This is an example of this is representing about 1,150 clients over the period of maybe 3 years. And this says, I don't know if you can see it, but this is about 20 to 6, and this is similar. It's about 7 to 19. So this is New Orleans and Baton Rouge. And so our control group had about 6 or 7 touches or contacts with probation and parole officers, whereas our treatment group had almost 19 to 20 touches. So that's average with the standard deviation. So this is a data point. What does this tell us? Did it tell us that we did what we said we were going to do? Pretty much. This is a good data point that we're talking about dosage. Did your treatment hit your clients, and how much? Oh, wow. Okay, so I'm going to push through this pretty quickly. I think we have our earlier version. Okay? Right, that's fine. All right, I'm going to push through this very quickly. We thought this was going to be a lot, but this is a really great example of the next level of your interaction with your data. The next level is essentially, all right, these are my different groups. This is a treatment group. This is a control group. Treatment, control. Treatment, control. If this is 0, and I'll just put your attention on 0 at this bottom bar, did my control group get more or less violations than my treatment group? So essentially what we have here is that what exactly I wanted to happen. I wanted my treatment group to use the probation and parole officers to use violations more than revocations. And bam, there it is. They did a great job. The control group, maybe they didn't detect as much crime. Uh-oh, whose theory are we talking about now? Right? So this is how you think through this process then of, okay, I have a data point, and then I have another data point that really expresses, did my project work? Okay, so let's go big. Let's go big and let's go into your program. Let's think about your program. There is a translation problem. If you ever sit and talk to, have you guys talked to evaluators? Does it seem a little weird? Do you speak a different language? We kind of do. We speak nerdies, and you guys speak real life, and we just kind of do this wah, 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 and it doesn't always play out. So I put this slide here to talk about practitioner language. If you ask me, did my program work? I look at you like, for real? OMG. There are so many things that we need to talk about. We need to talk about, did you follow model fidelity? Did you follow your program? Right? That's a lot of data to talk about. All right? How do you define worked? Does it mean they just went back to jail? Well, shoot. In New Orleans, we arrest a lot of people. Okay? Traffic violations. Does that mean they recidivated? So now you have to make some gradation between that. All right? What are the critical outputs and outcomes? And I'm just going to run through the rest of this. Which components work best? You say that to me. But guess what? Sometimes these components work together. How am I going to deal with that? Are there cost savings? Well, I have to develop a cost model. And what does that include? Court fees, prison costs, police costs, all of those things. These are considerations. So when you ask your evaluator a simple question, they're never going to say yes, no. They won't do that. We can't. We literally can't. All right. So very quickly, what I did here was say, okay, these are outcomes with revocations versus, again, treatment control. This is New Orleans, Baton Rouge. Treatment control, broken down on whether you're a gang member or not. And what I found was there are differences in revocations in one specific group, but the other groups were very similar. What does that mean? I take it a little further, and I say, okay, let me look at who got more jail time. Right? Were these just small arrests? This goes back to our idea that we have to define what is success. You guys have to tell us on a real level, everyday, practical, that guy was revoked because he needed to be revoked, right? Or this guy got a traffic ticket, and then he didn't pay his child support, and then this happened. And then all of a sudden, you're seeing a group of people maybe in this gray area, or I'm sorry, baby blue area, that's where you need to focus your program on, okay? And so let's wrap up here at the importance of looking at a layered approach, because you're not dealing with simple situations. How in heaven's name is your data or your evaluation going to be simple? You might want to talk about qualitative analysis. You might want to talk about, okay, I've got these outcomes or these outputs, but I need to put them in the context. And so my colleagues are going to talk about that. Overlapping sources help to strengthen your findings. So if you want to go and say, look, I really need this policy changed, I only have one data point. If you layer it, there's so much more that you can say, right? So mixing quantitative with qualitative. And please, y'all, do not be afraid to talk to your clients. Don't be afraid to ask them what you're doing wrong and what you're doing right. All right. Finally, I think we can save this for question and answer. What I feel like would have made a lot more sense for me to do. And I want to turn this over to Dr. Neiman.
Well, before that,
Yes, sir.
we're turn over
that's
the
right.
question
Okay,
and
turn over.
answer.
Okay,
Thank you
hey.
so much.
Perfect. Thank you.
And
What, you want to leave it on that slide then?
Yeah, let's do
All right.
that. That was
Awesome.
great. Thank
Yay.
you.
Thank you. Oh, I forget that.
And so we'll open it up for questions here. for folks in the room as well as online. Is my mic on? It's on now? Okay. So now we're opening up for questions and answers. Thank you so much, Sunita. That was really helpful. I think the translation piece we can't overstate. I know a lot of times talking to programs, you ask a question about evaluation and they feel like that's automatically the evaluator's realm, and I think you did a great job in saying, no, we're all in it together, and you need to be able to answer the general questions about what you're trying to accomplish with your evaluation. Are there any questions in the room?
We have a question from people at home.
Okay. Can you hear me?
Hi. So we have a question for some people at home for Sunita. They want to know, how do you have a control group in a rural or a small area where there's just not a very large population for them to evaluate?
Do I get to defer any of these questions
Yes,
to my
absolutely.
colleagues? So, do you wanna try that, Melissa, or I can follow up?
Yeah, so there's a couple different things you can do, not least of which is, I'm going to talk a little bit more about this in my presentation, but we'll cover it now actually because then we can kind of slide through it, which are proxies, right? So if there are certain characteristics of a population that you're trying to track or follow, for example, in Lowell, our program specifically looks at Hispanic Latino males between the ages of 30 and 45 with at least 2 arrests, right? That's pretty specific. But you may not have a big enough population to make a control group that would match up the folks you're working with. So what you do is you take similar characteristics within your community and you can subsample from them and create a proxy. And so they would be a similar group. They may not have all the same exact definition, they may not have all the same exact, but they have enough that you can use them as a comparison group to your original group. And that's called a proxy group. I know people like to say, well, is it rigorous? It's still rigorous. I mean, you're still following a lot of the similar things. You just have to disclose the areas where you had to create a proxy. And rural areas is definitely one where you see this happen a lot.
Thank you. Any other questions? Back.
Hi, Sunita. Just want to say thank you for your really great pictures in your slide presentation. Coming from a fellow nerd, as it pertains to program fidelity and measurement, I'm curious about programs that implement a process and then realize that they're not actually being so true to the model and are collecting data, and what do they do midstream when they realize they've collected data? They have to change their dosage, they have to change their program participants potentially, and everything kind of gets really discombobulated all the way through. Do they stop collecting, start collecting? How do they proceed from there, and how do they communicate that story?
Right, that's an excellent question, and I won't say that we're not dealing with that. I think it's almost impossible to do exactly what you say you're going to do and hit timelines. And so often what I do in that situation is no more nerdies, I want to use the word cohort. But essentially cohorting means that I take a group that has similar dosage and similar situations, and I look at them. And then I look at any group that's different, and I put them together, and then I look at their outcomes. So, the only difficulty with cohorting is if you're doing regression analysis. And regression analysis allows you to look at multiple relationships at the same time. But if you've found that your program changes midstream, then regression isn't as important. What's important is to say, okay, looking at treatment and dosage, and under all specific situations, this is what we found. And then you put that in your reporting and you say, look, we had a bottleneck and this many people didn't get this much treatment for this much time. And then when they did get the treatment, we looked at them specifically on that timeline, and look what happened.
That's great advice. Thank you. That happens a lot. Yes?
Yeah, I think
Melissa?
the one thing I would add to that would be that I'm sure many of you have had other federal grants, right? And so you've always heard the term mid-course correction. Everybody's heard that term, mid-course correction? Okay. So the interesting thing about a mid-course correction is exactly what she's saying. So you can actually separate your two groups. You can say, we did it up to this point when we realized, maybe this wasn't the best approach, or we had to make a change. And so from that point forward, I always make this, never stop collecting data, okay?
Right.
But you can always demarc in the data where you've changed course, so that you can actually, in a weird way, you may actually have a really neat comparison level there.
Yeah.
But at the same time, you actually now have two different streams to look at what may have worked and may not have worked. So always find a way to make, lemonade out of your lemons kind of thing. But
Well-
never stop collecting. Never.
One final comment on that. I think it's so important that you get the chance to find out when you're making mistakes. And what happened is the evaluation ended up being the mechanism to find the mistakes, right? So look at it as a strength.
Okay, I'm going to close question and answer for this first part. We'll have a couple more sessions. But for now, I'm going to turn it over to Dr. Neiman.
So hi again. It's been so long. Everybody staying awake? You had a good lunch? I want to make sure we're all awake, right? We're all with it? All right, good. So I'm going to really quick go through a couple key points, how to use data for more than just reporting. This is probably the most important thing for me. When I get called in to work with groups, and I work with a lot of different groups, the one thing that happens is, well, what do I need to capture so that I can do my reporting? Because I just got to get the reports out. Everybody feel that way? I got to get the reports out, right? Okay. But the thing is if you're going to have to do it, make it worth your while, right? Make sure it does more than just one thing. So, and how do we get hard to find data? Because there is always inevitably some hard to find data. I think the question about how do I find similar groups in a rural area, that's hard to find data, right? Defining your success with data and sharing your data, which is the most critical part. You're doing all this work, you're collecting all this data. Anybody knows what happens to most of your reports when you collect data? Yes, they go on a shelf and they collect dust, right? They are great dust collectors. So don't let that happen to you. Figure out a way, and then we'll talk a little bit about it, and certainly Tracy will really get into this, about how you can use your data to really share, inform, change your community, start changing ideas, start changing minds, and maybe even think differently about other things that go beyond just your program. Because then you're really making change, right? Small steps make big change. All right. So let me share with you guys. I'm an academic and a practitioner. I teach classes on research data. This is how people feel when I talk about data. They get nauseous. They get backaches. They get muscle. I've had people lose their lunch. I've had people shuffle off to Buffalo and walk out the door on me. So honestly, I get it. When people come in to talk about data, other people look at me, their eyes glass over. They start to fall on me. So I'm going to try and make this a little entertaining. Data does not have to be boring. Data does not have to be bad. Data does not have to be your enemy. Data can actually do wonders for you, and you don't even need a lot to do it. That's the best part. You don't need a lot of it to make real impact. All right. So if you're going to collect, make it worthwhile. This is what we typically do, what's called sufficient. We do enough to get the job done, right? We collect it. It's short term. It's terminal. I have a project. I'm getting paid for 18 months on this federal project. I'm collecting 18 months worth of data. Done, right? But that's it's very short-sighted. And let's face it, if all of you had the benefit of people collecting data meaningfully in other projects, how much better would your projects be now, right? If they had that data set up for you and you could use it now in how you're thinking about what you're doing, that would change a lot of stuff for you. So don't let that happen. Instead, I like to call it making it dapper. Have dapper data. Doesn't everybody want dapper data? Dapper data should be directed, right? It should be determined. If you want to know how much somebody makes, don't ask, and I can't tell you how often this happens, don't ask on a survey 6 questions about how do you feel about what you make per year? And how do you think what you make per year matches up to what other people make per year in your community? And how much do you think you make in relation to, the HUD scale of you should be making no more than 30% to pay towards your housing and blah, 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 blah. If you want to know what people make, what should you do? Just ask them. One simple question. Don't overcomplicate it. And sometimes we do that because we think that asking certain information is very, it's touchy, it's this, it's that. Okay, but people have the right to not answer a data point. We all know that. We say that right out on surveys. We say you don't have to answer what you don't feel comfortable with. So be direct. Ask the question. Make sure it's adequate. You're measuring what you say you're going to measure. Oh, I can't tell you how many times people say, oh, well, I measured how much, I measured whether or not a person could stay in their home. Well, how did you measure that? Well, I checked to see if they had a driver's license. Really? What does that tell you? That doesn't tell you much of anything. So be adequate. Make sure it's doing what it's supposed to do. Purposeful. Be very purposeful about what you collect. If you're going to take the time to do it, make sure it counts, right? Because the last thing you want to do is have to go and collect data 2, 3, 4 times over. Environmental, and this is the most important one, and a lot of data people don't talk about this, but every one of your communities is different. All of you are snowflakes. Everybody heard that? You're special snowflakes? All right, so let me give you an example. Lowell, Massachusetts, if you don't know, is the second largest Cambodian community, refugee Cambodian community after the Khmer Rouge in the US, second only to Minnesota, right? The issues that we have to deal with in Lowell have a lot to do with immigration, refugee status, PTSD, lots of mental health issues. There's a lot of contextual things we have to think about in Lowell that, where I live, by the way, which is Manchester, New Hampshire, we don't think about. I don't ever think about these. This is not an issue in Manchester, New Hampshire. Manchester, New Hampshire, our issue is poverty. Serious poverty, rural poverty. We have major poverty in my state that are pockets of poverty, but because our state does well economically overall, nobody pays attention to it, right? So contextually think about those data points because they make a big difference, and I'm going to show you why in a second. And the last one is reasonable. Be practical. Collect what you can collect. Don't go to extremes to collect data that's going to cost you too much, because let's face it, all of you, do all of you make millions in your projects? Are all of you pulling down like, $250,000 salary? Probably not, right? So my point is, you have limited time, you have limited capacity, you have limited funds. So be careful about how you're collecting your data. So that's why make it dapper data. All right. So to the point that I was making about environmental and contextual, this is what I hear often. I'm going to give you 3 points that I always hear about data. The first point is that, how do I prove my program made a difference? My program, we did it. It's us. We made the difference. That is called attribution. That is where you say, my program made all the changes. How likely is that? Right. What we should be thinking about is called contribution. Our program contributes to a change. And this is the same rationale you make when we talk about those environmental factors, right? So what you're talking about is, we can't talk about, I'm going to go back to Lowell here. We work with men. We can't talk about the fact that when they come out, they don't have a job and they don't have housing without talking about the economy. Lowell is right outside of Boston, one of the most expensive cities in this country, right? So the same expenses that you have to pay in Boston, you're going to have to deal with in Lowell, despite the fact people in Lowell don't make anywhere near that kind of money. So what we have is, what we found out by looking at other data, is that a living wage minimum in Lowell is $9.50 an hour. And we've all heard about living wage right now, right? This is a big issue across the country. This is pretty familiar to all of us. So if we have guys who are coming out, they need a home, they need housing, and they need a job. What good is it to put them in a job that's going to pay them $7.50 or $7.75 an hour? They're not going to make their bills. So it's not enough for us to think about our program needs to get them a job. We also have to think about, is it a living wage job? Is it going to keep the roof over their head if we go through all this effort to do it? So this is when we start to think about contribution. Look at other data points. It's not just your program. Your program exists within an entire environment. And it's okay to look at those other points. In fact, I would bet just about everybody here who is giving us these lovely grants and who wants to see these reports are going to love the fact that we can tie it back to how we can actually make change in our community. All right, so this is the difference between primary and secondary data. Primary data is what you collect. Secondary data is what already exists. You don't have to go out and poll everybody to find out what a living wage data is in your city. Somebody's already done that for you. That's secondary data. Grab that data. That's what's going to help you think more contextually about what your data means in your overall environment. So primary data is good. you're going to have to collect stuff, right? You're going to have to collect race and ethnicity and age, and you're going to have to collect certainly a lot of information about their criminal history, criminogenic factors. But think about it in the perspective of there's other data out there that's going to help you get that secondary data. Recidivism data is something sometimes it's very hard to get. I understand. So there's a couple tools you can do for this. One is you certainly have the folks you're tracking anyway, right? So you're going to have that data. That's first and foremost. But second off, is everybody aware that the BJA has a tool out there that is a recidivism analysis tool? You can Google it. Google solves all, people, by the way. Google solves all. All right, so there's a tool out there that you can go to, and you can put in really cool factors. You can put in gender and age range and ethnicity. You can put in however many arrests, certain criminogenic factors, and based on a query of several different states, it'll throw back to you some recidivism rates. So when you're looking for data, comparative data, data to sort of look at against your own, you may not have the tools. It does happen, especially rural. We got that one question about rural. This happens a lot in rural. Right? They don't have the capacity to track the way many major cities do. But the BJA does have this. You can Google it. It's a free tool. Doesn't take you anything. It's right there on a website. Some major cities have it too. New York City has the DART. Same exact thing. Does exactly the same thing. DC has it. Philly has it. Boston has it. Austin has it. Lots of them have it. So you just got to get a little bit familiar. Google, like I said, Google solves all. And find yourself a couple analytic tools to help. One other thing you can do, what we did in Lowell, was we had a great agreement with local neighborhood cities. Because it's not just because you live in Lowell doesn't mean you're necessarily going to get arrested in Lowell, right? Okay, so we had a great working relationship. We still have a great working relationship with all of our neighborhood cities and neighboring cities, and sort of said, we're collecting this kind of data. If you can help us out, we'd love to be able to bounce information off of you. Also keep in mind that arrest records are also public. So work out deals, get an MOU going, work with your local officials. 9 times out of 10, when they kind of understand where you're coming from, they're willing to work with you. And the last one was using proxies, which we actually talked about, so I won't take our time to do that. Here's the third problem that I get. So the third issue that lots of folks love to throw at me is, how in the world can I possibly show success, right? Because let's face it, to say that someone's never been arrested again, that would be a lifelong thing. How do I prove that? I like to use the one on substance abuse, right? Because if anybody knows substance abuse programs, you're never technically out of program, are you? It's a lifelong commitment. Okay, so how do you show success? How do you say someone's been successful? It's not just the amount of time that they haven't done it, right? So the real answer is it's not about just the big success. It's about how small successes get you to big success. So the way you do that, you create milestones. The minute someone gets let out of Bill Ricca House of Corrections or the Department of Corrections in Massachusetts, right, they go through a reentry center. She's going to talk about that process. When they come to the reentry center, certain things have been identified for them. They need housing, they might need a job, they might need substance abuse, right? During that time, once we set them up for whatever one it is, in this case, let's say substance abuse, we create milestones for them. Guess what? You go to your first meeting. Completed. That's a milestone. Did you go to a month's worth of meetings, 4 meetings? Check that box. That's a milestone. Did you go to 3 months worth of meetings? Check that box. That's a milestone. Now, here's what's interesting about this. When you create milestones like that, you also create opportunities to find where failures or gaps happen. If you found that 90% of the people who came out of the Department of Corrections go to the first meeting and go to a month's worth of meetings, but you find out that something happens between that month and the 3-month checkpoint, why would you focus all of your attention as a program in getting them into that first meeting? Where would you start to focus your attention if you're that program? Retention between that 1 month and 3 months, exactly. That's where you can focus. Now you know how to focus your time and energy, right? Again, you have limited time, you have limited capacity, you're working with your program partners, but now you have the ability to sit together at a meeting and say, guys, this is where we see a major gap happening. How do we get our hands around this? Because we want to keep that circle of care. That's what we're trying to do. So, small successes, create milestones, and they're great data points for you to be able to check along the way. And that becomes important because this tells you how then to communicate. Because the one thing we don't do enough with data is communicate. Other than people love to throw stuff out on Twitter or Facebook and shock everybody. That's always a good one, right? 90% of the sky is falling. Yeah, it's called rain. It's good. We're all right. But we talk about, we don't communicate enough about our data, and we don't do it in a way where people can always understand it, right? When you tell folks, hey, you know, or when she made the point that, like, we arrest a lot of people in New Orleans, it just made me think, I'm never going to New Orleans, right? So I was like, I'm never going to go, but, right, that's not what she meant. So it's all about how we communicate the data. So think about those layers of data, right? What did I say? It's not just your program. It's your program within the context of your entire community. So think about the layers of data. Simplify. People want to look at simple information so they can digest it and then figure out what their questions are from that, because that helps guide you in how you're going to keep your program going, how you might think about sustainability over time, and most importantly, how you think about whether or not you do have to make a correction later on, as was pointed out. Communicate often, and this is probably my favorite part of what we've done here at Lowell, was that we created a mechanism where we meet once a month. And you all just got a copy, and I'm going to show it for those of you who are looking at us live stream. Everybody here just got a copy of a dashboard. This dashboard is something that we created. It is Excel-based, so no complicated stuff needed here, folks, right? Anybody who can do Excel, you can do this, all right? It is a dashboard that we share with each other once a month. We sit down with all the program partners. We go through, we look at the information and say, how are we doing? And then we have a conversation about that. And what you don't have is the second page to this, by the way, which gets us into the flag report. And I'm going to talk about that in a second. We connect with other programs to look for overall need and impact, which is what I'm talking about. This dashboard gets there, and we're going to get to the dashboard. I'm going to show a detailed thing about that. And then we also look at multiple program effects. Isn't it possible, and this has actually happened for us, where we have folks who come in who, what are your first, Maslow's hierarchy of needs? What's one of the first things you need when you get out of the Department of Corrections? Shelter, exactly, right? You need a roof over your head. If someone comes out and they've been identified with 5 different things that they need, the first thing they're going to want is a home. So they're going to focus on shelter. They're going to focus on a job. And even though they've been identified for substance abuse, right, that's probably going to fall to the wayside until they get those 2 things done. So when we have the opportunity to come together and talk about data in a meaningful way like this, we can start to talk about, hey, employment guy, hey, housing guy, can you help me? Because as the substance abuse guy, they keep shoving us off. It's a wraparound. We have to go to where they are at. How can I get them into us, right? There are ways to do that. And now you can have that constructive conversation. And you as the program, by the way, this is the best part, you as the program manager kind of can sit back for a second and let them work it out. And once they work it out, that gives you a mechanism to say, okay, well then here's how we're going to track it going forward. So it really does change the conversation. It makes all of you informed in the same way. So you get a higher level of view at any range you want. This one that I created, actually you can date range it for any date range you want. The one you guys are looking at, I think, is 6 months worth of information, 9 months. It facilitates conversation, and the red flag report, which is the most important part. The red flag report actually has a code that identifies every person in our system, but it's code, so you can't tell who it is, all right? And so, but that code is known by the program manager. So what happens is in there, it'll check off. This person was identified for housing. This person was identified for employment. This person was identified for substance abuse. But if they have not been touched in 30 days by the program, it gets a big red X. So guess what you've just done? You've just identified when someone has fallen through the cracks. You know that infamous term? Ooh, they fell through the cracks. We don't know where they went. Now we know where they went. Guess what? He's got a green check on housing and a green check on his job, but a red X in substance abuse. So what does that tell you? Right, exactly. Right, he's got his house, he's got his job, but he needs that connection back to substance abuse. So now we can have that conversation about, hey, look, guys, we see a lot of guys falling through the cracks here. And it makes sense. This is not, by the way, accusatory. That makes complete sense when you think about it. What good is going to substance abuse treatment if you don't have a roof over your head and a job? We also have programs, by the way, that are in there that are things like what we call the pro-social effects, which are to reintegrate a lot of these guys back with their kids, because a lot of them are struggling with getting back. Which is interesting that we see a lot of green checks under the pro-social, but a lot of red X's under substance abuse. So it's not that they don't know how to necessarily prioritize even beyond the housing and the money. They want to be with their kids, right? So when you start to tease this apart, you can see the complexities and the barriers and the challenges that a lot of our that a lot of the folks that we work with deal with. So I'm just going to show you really quick what this looks like. I told you it's in Excel. And this is the first half of the page. And you can see it tells you how many are in the system. It tells you where they're at, where they came from. BHOC is Billerica House of Corrections, Department of Corrections, and other. Our goal was 85 people. We're at 43 at this point. You can see the different level of risks that we've had to deal with. So that's some general information. But here's where it gets interesting. See where you see the goals and flags at the top? So you can see the different types of services we have, and then how many had red flags. And what did I tell you? What's the one we see the red flags in the most? Substance abuse, which is precisely what you would expect. They're worried about getting some primary stuff done first. Then we've got our goals, how many people have completed their goals, and we even track recidivism. We can tell you that it's been, for those who have recidivated, it's been 106 days, so approximately 3 months when you kind of get down to a little bit more. And then there's the red flag report that goes with that, which we didn't share, but it gives you exactly the same idea that I said with the check marks. And I'm sorry, I ran through that a little bit quick, but if anybody who's home wants a copy of that same sheet, we can get that to you.
Okay, great. Thank you. That was really informative. I really like the push on dapper.
Yeah.
I'm going to
Gotta be
remember
dapper
that.
data.
I'm going to remember that. Any questions? There's a lot of information there from online or in the room. Yes.
Am I willing to share the Excel spreadsheet? I am willing to, from where we stand, it's actually owned by Lowell, so I actually built it for them, and it was a small amount that they paid to have it done. So, but I'm willing to sort of let you know how to construct one if that's sort of where you want to go with that.
Mm-hmm. Okay.
And
That's,
I'm sorry, but it is constructed for individual programs.
Mhm.
So what we really had to measure through meeting with our stakeholders, through doing the strategic plan, through looking at the BJA report, is what do we want to actually collect, and how does that apply to the program that we're actually running?
Yeah.
So it's an amazing, great, usable database that's feasible and user-friendly, but it's not just a packaged tool that you can buy and
Yeah.
start using for your
Yeah.
program.
Totally catered
So
to your
it's really
program.
Right.
based off of what we were doing.
And,
Yep.
and I love that you used Excel, because when you mentioned, it doesn't have to be complicated around
Nope.
the data you can collect. The next question we often get is, what database, what recommendations do you have? We don't have a lot of resources, but everyone has access to Excel, and it gives you the option to really customize it the way you all have done. And you have some people that are better at that than others, and as a group, I'm sure you internally can find out the best way to construct that. We have a question in the back.
And while that question is setting up, just so you know, the individual program partners have their own data sheet that they can't
Yes.
see each other's stuff on. She's going to get into that a little bit, but their own data sheet that they fill in that feeds into that. So it's completely customized, specific to the partner, and then it rolls right up into the program manager, and it's all Excel based for that reason. Very simple.
Great.
Just to piggyback off the Excel point, I know that you mentioned to never stop collecting data, no matter what you do, and I think it's a valid point, but sometimes I think we find ourselves in a place, why are we collecting this data, or what are we trying to work for? So I guess to the Excel point, if we don't know what we're collecting and what we're going to use it for, are there any other data systems or case management systems that we can use to kind of help us so that when we do get to that point, we have what you need or what an evaluator would need to be able to do something with it?
Yep. So the first thing I would say is that I'm going to go back to Sunita's point, which is that you should really have an evaluator in the room when you first start your program. If you haven't, it's okay. I'll get you through that too. But you really should, because they kind of help you think through this data that you want to collect. That said, many of you have, I'm presuming, community partners that are community organizations. All of them have data collection. They have to keep case management somehow on their folks, right? So the truth of the matter is that a lot of them are already collecting some level of data. If you found that you didn't have an evaluator at the time you started building your program, if you didn't have someone there to help you thoughtfully think through the different things you want to collect, or halfway through you realize, ooh, I really wanted to collect this extra data, go through your partners, figure out who amongst them might actually already be capturing this, because there's a lot of programs out there. There's Salesforce and PeopleSoft and all that kind of stuff. And a lot of them are going to collect some of the most basic data that you could probably use anyway. What you want to get to, though, is the point where you're thinking about how does that data interconnect? And that's where something like this becomes so valuable to you, because it is personalized, it's individualized, and it allows you to connect the data and connect the dots in the way that will be most impactful to you. So use their data if you have to, but in the meantime, always be thinking about how to get your own.
I think we have a question from online.
So the online audience wants to know, you're very excited about data.
I roll in Excel sheets
Yes.
on a regular basis. I do. I'm
So they're interested in knowing, how do they get their teams excited as you are, right? So if you have folks, you know, I can only speak for myself. I almost dropped out of a master's program because of the statistics class. That's a true story. I know, this is painful.
You could have taken it with me.
So how do you work with your team? You know, so you have someone like me or other people that are very afraid of data or don't really understand the importance, or just, as you were saying earlier, gloss over. How do you get them to get as excited as you are? Because listening to this, we're having a lot of feedback. And what are the guiding principles, or just, you know, some advice?
So this is the way I operate. I understand people don't love data the way that I do. I understand most of you don't have binary code on your shower curtains, and you probably don't wake up every morning and go, numbers, numbers, numbers. And so I get that. I think the best thing you can do is find an evaluator, because this is the other part we don't do. We often we don't shop for evaluators. That's not normally what happens. What happens is people kind of go out there and they're like, oh, we've heard of this evaluator, we'll just pull them in, right? So we don't shop enough for them. So find an evaluator who's dynamic and who makes data reasonable and rational. And frankly, I think the thing that I love the most about being excited about data is that I'm excited about it because I think it can be real. I think all of you could embrace data, and you don't have to leave a master's program almost on statistics. Because I teach, by the way, I teach my statistics class with comic books. If anybody knows comic books, right? So if Batman has this many people bad in Gotham, and there's this many people bad in Metropolis, how do we talk about it? So I mean, you can make it fun. You can make it fun. Look, here's the thing. We are all doing really serious work here, actually, right? These are people's lives on the line. We all carry a very serious weight when we do that. I cannot emphasize this enough. There is enough weight on our shoulders that if we don't make something light and we don't make something better out of it, we are not doing ourselves any favor. So find a way to make data fun, and find a person who can come in and help you make data fun. They may not make it joking, but get somebody who's really passionate about it but can convey that passion and help you convey that passion so that other people want to hear what you have to say about data.
I want to add something to that. I think it's really important for you guys to have a good experience. I mean, just because the camera's not on you, how many of you have had a good evaluation experience where you've been able to turn your numbers into an appreciable change in your program? Okay, I've got 2 hands up in the room. 3. Yeah. So I think that's the difference, is that the mentorship of being able to translate your data into policy or programmatic change is really what you might need. And that is a process. So that's what we're here to talk you through, is the process of getting there. But once you start having that, and then you start having a battery of questions that you know you'll always ask for the data for as you move along, then this becomes a part of who you are and how you operate.
So thank you very much. That was really helpful. And now we're going to turn it over to Tracy.
Okay. Oof, that's a heavy mic. Okay. So hi everybody, my name is Tracy Jackson. I am the Leap Reentry Program Manager at the Lowell Police Department out of Lowell, Massachusetts. Sorry, I can't talk and click. Okay, so I'm really here today. I do work with Melissa Neiman. She was one of our consultants and researchers and evaluators for the program that we have in Lowell. But I'm here today really to talk more on a programmatic level. So once you've met with your researchers, once you talk to evaluators, once you met with the stakeholders, once you got buy-in from the community, once you got your target clients, now what? You have this tool that someone created for you that should be amazing, very user-friendly, but now what do you do? How do you implement it? What are the things that you need to keep in mind? So what I really want to touch upon is training and identifying staff, incredibly important in the very beginning stages, tracking recidivism, which we've kind of talked about along the way, but also talktalked about some just practical and simple things that you can actually do so that you're tracking recidivism throughout the year, not just at the month mark or 18-month mark or 36-month mark. How do you know from month to month who's recidivating, what's going on, how your clients are doing? And then also using data to affect decision making. Because as we've all said, once we've gone through this, is you have this data, but now what can you do with it? What's the purpose? To put it in the binder so that it collects dust, so that you can do your BJA report, or so that you have a successful program, or so that you can take a program to the community and say, look, this is what we're able to do. Or this is not what we were able to do like we intended. What changes can we make? What kind of buy-in can we have from you to make these changes? Okay, so I just want to briefly talk about the way the program is set up in Lowell. And the reason why I have this diagram up here is because we are talking about data collection. So the way that we designed our program in Lowell, we have our overarching goals. We want to reduce recidivism, increase economic vitality, and then decrease the stigma that's also attached to working with ex-offenders. Because a lot of times you'll realize, I'm sure, you'll get pushback. There's a stigma attached. How do you also reduce that with the work that you're doing? So what we do is we have a continuum service model, or circle of care model is what we call it. And that's what you'll see here. So we actually get our clients from, I do work with the police department, and we get our clients from our local county jail, which is the Borough House of Corrections, BHOC. We also get clients directly from parole, which is incredibly helpful. And then we work with 7 different funded community agencies. So we targeted areas that we thought our ex-offenders had needs in. So we wanted to target pro-social activities, health and wellness, career opportunities, housing, education opportunities, and then youth services. And then obviously that filters into the LEAP Center. So that's where we realized these are the needs that our clients have. How are we going to help them meet those needs? And where's the information going to come from? I can't provide them with everything. So we have community partners and we have collaborative resources that we're actually working with. They're going to start providing me with the data that I need to really see the success of the program. Let's see. And I will say we also have a few unfunded partners that we're working with as well, just because they are in support of the program. They see it's a community need and they want to help, so it's great. Okay, so what we have, kind of like topic areas. So these are all the things that you really have to keep in mind when you initially begin implementing the program. So these aren't things to think about once you're 3 or 4 months in, because then you waste a lot of time backtracking, which happens. And it takes away from your program if you have to backtrack 3 or 4 months just to do the simple things that should have already been in place. So first off, you have to really determine who's going to have access to the data that you're collecting. That's the first piece of information to keep in mind. Because we're working with ex-offenders, because we're working with people who probably have maybe substance abuse issues, mental health issues, a criminal history, there's going to be sensitive data that we have. Who do we want to see that? Should everybody see it? I work with parole, the police department, the jails. We work with community partners, funded partners, non-funded partners. Should everybody have access to that information that we're collecting? It needs to be determined very early on. I mean, personally, for our program, the answer is no. It should only be pertinent information for people who really need it. But that's obviously determined by the program that you run and who you're working with. The second thing to consider is who's going to give you that information? So as I said, I work with community partners. They're the people providing the direct service to our clients. We, let me backtrack just a little bit. So we, with our circle of care, what we do is we identify clients who are eligible for the program, meet with them, tell them about the program. If they're interested, we provide pre-release services to them. So that starts in the jail. When we provide the pre-release services, what we do is we sit down, we map out a plan, and we say, what are your needs? How can we meet your needs? These are the social service agencies that you can seek help with when you get out. So we've already identified the agencies that they're going to see when they get out. Then post-release, we start working with them to align them with those agencies. So the good thing about that is even if they don't see me when they get out, as they're supposed to do, they still know where they go when they're supposed to get out. So one of the things that, like I said, you have to consider is who's going to give you this information. Sometimes this is a very clear-cut answer, sometimes it's not. So let me backtrack. For Educational opportunities. We have one person who was hired to do the high stat prep work and high stat testing through the grant. That's one person at the adult ed who has contact with our clients. She gives us all our information. She touches base with all our clients. She does all the reporting. But then we have, say, our health and wellness. That's a whole bucket of different people. And under health and wellness, we also have our substance abuse. So the substance abuse agency that we work with, we have 2 people who are actually hired under the grant. One who does direct outreach in the jails and in the community. Another one who is a clinician and will do mental health counseling. Then we have an outpatient program. Then we have a residential service provider where we have 2 beds. So now that's one organization, 5 people who are potentially working with our clients. Do we want 5 people filling out a reporting system? Do we want 5 people reporting to us on what's happening? Again, probably not. I won't give you an answer, but probably not. Because you won't get accurate information or you'll get a lot of overlap. So it's really important to identify who's going to give you that information. And sometimes it's not always the person who's actually working with the clients. Sometimes it could be the person who is the intake coordinator for that agency, the person who's at the front desk, who has access to the computer system and can say, oh, so-and-so has been here this many times a month. This person doesn't have their insurance in place. This person has called and canceled X amount of times. Because a lot of times, the clinicians, they don't actually set up their own appointments. They only know who they see or who shows up. They can't really track all the clients who have been referred to their agency. So again, that's something that you do have to work out ahead of time. Let's see, putting systems into place to accurately collect data. So that's something that Melissa touched upon just a bit. I'm going through this kind of quickly, so if you guys need me to slow down, give me a slow down signal. So as Melissa said, what we did is I am the program manager, so I have access to all the information that's coming in and all the data that we are collecting. But each agency has their own little, like semi-data collection system. So they are actually only able to see and input information for their agency. Again, they don't have access to all the information that's going on. The person who's working in employment services does not know who is in our substance abuse program and give them the Vivitrol shot. They don't know who's been identified who has mental health needs. So if I'm the guy in employment, I'm only recording employment data. That's all I see. We upload it, click the pillow on the Excel spread. Melissa taught me that. Click the pillow on the Excel spreadsheet, upload it, send it to me. I input all the data, and that's how we get the that data page that Melissa printed out for you, the data dashboard. So that's how we really calculate all the information that's coming in. And also, it's a good way to maintain privacy, client privacy, because depending on who you're working with, you may have to worry about HIPAA laws, medical records, all that stuff. Okay, so how to manage ongoing training needs, very important. Like I said, we're working with a system, hopefully that's been in place. It's very user-friendly and it's going to meet everybody's needs. But there's always going to be questions. There's always going to be someone who can't figure it out. And because we are working with a very dynamic group of people, their situations are always changing anyway. So there's always going to be a process where you're learning and growing and figuring out how to really input the next data set, because it may be complete 3 months down the road, information may look completely different than it did 2 months ago. So it's very important to manage training needs. And the way that you can do that, and I think would probably work best, depending on what system you're using, is just do quarterly updates. Quarterly, you can have people come in, go over the system that you're using, have them input client information, do practice testing, say, for example, when this happens, this is how you enter in this information. And if you're lucky enough to work in an Excel sheet the way that Melissa designed it, as things come up, you can actually design the data that you're collecting around new occurrences. So one of the things that happened with Lowell, so we have a really high opioid addiction problem in Massachusetts. I think we actually declared it like a state of an emergency. It's actually so serious. So we realized that we accounted for substance abuse, but realized that probably 90% of our guys who were coming out of jail had a substance abuse issue. And and we weren't able to accurately track it just based on what we thought we had to collect in the very beginning. And then we started a new program which was called the Vivitrol shot. So anyone who is a heroin user or uses opioids, they could get this Vivitrol shot. That was something that one of our service providers was actually providing our clients, but we didn't know. We didn't know that 6 months ago because it was a brand new program, but yet it was something that we should track because this has to do with their success. If they're not using, they can work, they can go to school, they can do all the things that we need to do. So let's start tracking who's getting the Vivitrol shot. That's one of the things that we were able to add in. And it was only because we were doing the ongoing training. So every couple of months we would come in and say, how does this look? How are you putting this information? If they're getting the Vivitrol shot, how is it being recorded? Oh, it's not? Well, let's update, let's make that change. Very important to have. And then the last really simple rule to establish very early on is deadlines. You want this information and you want to be able to do something with it. If no one ever gets it to you, you can't do anything. If you have to manually go to each agency and track it down, or each person, even if you're in the same building, if you have to go to everybody's desk just to ask for this information, it's just not worth it. It's almost like, why do we have this great tool to use if nobody's using it? So you have to establish deadlines very early on. Okay, so tracking recidivism. I am lucky enough, I work for the Lowell Police Department, but we're more of a community-based setting, so I'm actually not in the police department. I'm not able to run a Bob. I can't do a query check. I don't do background checks. I can't get a Lattimore system. The way that it's set up for our program is at the end of the 12 months, we can input all the client data, run a report, find out exactly who's recidivated within that last 12 months. Not helpful until that 12 months. So we really need to know what's happening now, what are people doing now, how are we tracking these guys. So one of the key factors is collaborative partnerships. These are established very early on. We work directly with the Barica House of Corrections, which is our county jail. They, after working with us, after learning about the program, and after me kind of going in and really kind of making a name for myself in the program at the jails, what they do now is they'll actually flag anyone who is arrested in the Lowell area or returning to the Lowell area. They'll run that report and they'll let me know. That's not something that was done before. That's something that we set up through the program. So now I think every week actually they run a report. So if someone recidivates, if I see someone's name again, I'll know. I'll know within that week if they're back in jail, which is excellent. Another collaborative partnership we're working with is parole. So they send their referrals directly to our LEAP program. And good thing about that is we have open communication. So parole will call me up and say, so-and-so just tested dirty. I just want to let you know we're taking them in. So it's not necessarily parole refers them, we don't see parole again. It's open communication. I check in every week. If someone's on the cusp, they will call me and say, hey, I know he's been doing really well, but I saw him hanging on the street. Maybe you should just check and make sure that he's going to that employment program you told him about. So that's one of the great things. And like I said, that's something that gets updated on a weekly basis, because you can't really determine the success of your program if you don't know what your guys are doing. And it's not enough just to say, we referred them here, they're using this services. You need to touch base with the guys, guys or girls, with the individuals, with family members if possible, and the service agencies that are working with them. You call those agencies and say, hey, have you seen this person? Is this person going in? Even if they can't tell you in detail what they're doing or what they talk about in their sessions, they can still tell you if they're going in. And then obviously, lastly, for tracking recidivism, it's difficult. You have to know your target population. So as Melissa said, we live in an area that's just outside of Boston. It's very easy for our guys to up and go to Boston and we never see them again. They could have been long-time Lowell residents who have never moved before. Next thing you know, you're working with them, you never see them again. So it's very important to understand that they're a very transient population that you're working with. So it's very good to kind of meet them where they are. Some may not have a cell phone, some may not have an email, but yet everybody can get on Facebook. It's strange, but no means of communication, but they can post something on Facebook. So sometimes you can't just expect to call a guy and say, hey, what's going on? Have you recidivated? Like, how are you going to figure out what they're doing in a way that you can communicate with them? Sometimes it's, that they go to the gym on a certain day. You ask them to stop by the center on that day. Sometimes it's telling a friend, telling a family member, just try to keep up with what they're doing. Okay, here we go. Okay, using the data to affect change. How to make data meaningful. Okay, so it's really, and this is one of the questions that was actually asked. So it's really important to establish early on, again, why you want to collect the data that you're collecting. It's great to collect data, but there's no reason to collect everything just to collect it. Really determine that at the end of your 12-month program or at the end of the grant, what is it you want to know? What are you really going to, when you kick it back to your evaluator and say, tell me this, what is it you actually want to know? So for us, what we did when we designed our tool that we use for data collection, we wanted to make sure that it could do 4 things. Obviously, we wanted to be able to pull information and run a report for the BJA quarterly reports, obviously, very important. We also want to make sure that we had a system that could manage our client data and demographics. Then we also want to make sure that we had something in place that would measure, are we in line with our 5-year strategic plan goals that we had in place? Because that's also something we want to consider throughout the duration of the program. And then we also wanted to know, we're working with community partners. Are our partners really coming through? Are they doing what they said in the MOUs? When we determine that we're going to work with you to provide this service, are they actually providing that service? So our system actually tracks that. And then what to consider when planning for the future? We'll just lump that into what I just said. when you pull the data, you run the reports, you can see. So for us, we worked with a youth group who served people who are 16 to 24. We serve guys who are 18 to 24, but it kind of fell in that range. When we look at our reporting system now, we can see that they've served 3 people in 6 months. Do we really need them as a community partner? Are they not doing their job, or do we just not have people in that age group? If we get renewed, what are we going to do next year? Should they really have a full-time position in this program? And then how to share and disseminate and collect data. Somewhat what Melissa talked about. We also want to make sure that if we're asking all our partners to do this, and this also has to go in with buy-in, if we're saying, be on board, give me all this information, and do it in a timely manner, we have to be able to kick it back to folks and say, this is what we can see. So when we do our monthly partnership meetings, that little handout that you guys have, I always pass that out as an update. I always pass that out so that folks can see, this is how well the program's doing, this is how well our partners are doing, or this is where we're falling short, or this is something that we really have to break down and talk about more. So they're always updated on a monthly basis on all the information that I see. So that is my quick run through.
Great, thank you, Tracy. And one of the things that you mentioned that really ties into one of the questions that we got from the audience about how do you get folks engaged. If you can't find a Dr. Melissa Neiman, who's just very excited, I'm into data, but you scare me. The other way to get folks engaged is to have data being presented on a regular basis with the expectation that you're going to act on it. And so that's something, when you're thinking about your evaluation from the get-go, don't think about the evaluation as this one endpoint. Think about, when you're having the conversation with your evaluator, how often are we going to get this information? It's not just about telling your story, it's about also improving your practices. So whether it's monthly or quarterly, you should have those check-ins to making sure that the evaluation's on track, and I really suggest that you do a pilot of your data collection tool, whether or not everybody is trained, because you don't want to say, man, that's not what we thought it was going to be, and you feel like you lost a quarter's worth of data. That's not helpful. But having those routine check-ins and people seeing that you're acting on it, that's going to increase buy-in. Everyone wants to know about who they're serving, and they don't have it. If you don't have the data, you're just left with anecdotal information. Any questions from the audience in the room? Let's get you the mic. And
Hi, Brenda Anderson with the City of LA. It's not so much a question as a comment in terms of piggybacking on what you've been saying. One of the things we found that when we're collecting the data, we do it on a month-to-month basis, and when we see a difference in the change, then we go back to the agency to try to ascertain as to what caused that change and try to figure out, is it something that we can address or is it something that's out of our control? And then we make a notation of it. If it's out of our control, then we want that note to be in there so that the next time if we see that, then we understand why it's that way.
Great. Any other questions?
That's using data meaningfully.
All right.
Really
Yeah,
meaningfully.
definitely. I have a question from online.
Hi. So we have some questions that I'll just read off in a theme. So if you were looking at your past self and you were getting ready to either finish your planning part or begin your implementation piece of the work, what would present self say to past self? You know, what are the real lessons that you learned, and what advice would you give yourself before embarking on this work that our grantees can maybe benefit from?
I can speak to that. I would think that accountability is key. A lot of times during the start of new programs, everybody is hyped up and ready to start, but then 6 months, 8 months down the road, you may see that start to fade a little bit. So you want to make sure you have a system in place to always hold folks accountable for what they're supposed to be doing. Whether you have the grant for 1 year, 2 years, 3 years, the accountability should be the same first month to the last month and all the way through. And then as soon as you start holding people accountable, that's when you actually recognize the change that you're going to see. So it's very important.
I had a question about the secondary data that you brought up, Melissa.
Yeah.
What are some data sources that folks usually ignore or don't think about? Because I think a lot of times evaluators come with a very complex, data request, and the resources aren't there. And so what are some things that we should be looking at in terms of data?
Yeah, I would say, so there's a couple things. One is, if your evaluator is left to their own devices, I say this in a Mr. Burns kind of way, you could end up down a very wicked, twisty path. So be really thoughtful. This is why I keep coming back to the contextualization about your environment. Be really thoughtful about your community. So I always go to the default. The default is this. Social factors. There's plenty of data out there that economic. You cannot ignore the economics of your community. And you cannot ignore the economic disparities of your community in particular. So economic reports, labor reports, and by the way, these are usually done regionally, right? Every census has their MSA. You can go through census data, you can go through Bureau of Labor Statistics. There's plenty of data out there. It just doesn't get used in the way that it should. So social information, voting. Look at where people economic data, housing data, social data. I always default to housing, to social and economic first. And my second level is always the community. There's always some data that's being captured in the community that's kind of unique. So for example, in Lowell, one thing that they look at a lot is green space. Green space, you cannot talk enough about how important green space is. Anybody here who's a public health person, and Nicole, I know you are, they will tell you that green space is pivotal. You want to talk about totally changing health dynamics for a community? Green space. The ability to have a sidewalk. The ability to go for a walk. The ability, by the way, to not have congestive heart failure or heart attacks because you're so anxious and you live in such a bad neighborhood that you're afraid to walk out your door. So that fear and anxiety creates worse health. All of that are data points that you can go and look to that are contextual that will start to pull those things together. So when you're thinking about data, go big, but think about it in relation to your community. Keep talking, I'm sorry.
By way, go ahead.
Right. Well, I thought it was a great question because I did ask previous self what previous self should have done. And essentially, just to go back to that question about how to do this and how I should have thought about it, we did one preliminary data run. We did one early analysis, and wow, it really made a huge difference. So either you can do this incremental data approach, which is wonderful, and I would say that I think I'll probably try that from now on, but it may not be easy to do with all of your partners all of the time. But the idea that if your project is how many months, you break that up into what feels right for you, and you do an early analysis, or just start counting. You know, how many people have you moved through the program? And we found 1, 2, 3, 4 bottlenecks. We found where our program wasn't working. So I would say like a midpoint or even a earlier than midpoint analysis. Now, this is something that both these Tracy and Melissa have talked about, confounders. I'm very interested from the group. Can you guys give me an example of a confounder when you expected data and, okay. Well, all right, so I'm not going to hear from you. No, nobody's hearing, nobody wants to know what you have to say. So, but this idea that it's real easy to miss something that's happening in your environment and you get zero data and you're wondering what's going on. You're planning your evaluation, your analysis off of this one point and it's not there. And also checking the quality of your data. So we hired someone and they were their definition and our definition. Hey, baby, that's when it got spicy, Shay. Come on now. So when you realize that you're not working off the same definition, we had a data dictionary, and I found out that I actually should have gone back to my data person and say, do you read this the same way I read this, right? So that's just one of, I'll leave it there.
All right, well, thank you. We're going to end on that note. And if you could please join me in thanking our presenters. I thought that was excellent. Thank you so much. So thank you, presenters. Thank you for all your questions. And the folks online, thank you for participating as well. Please stay tuned for more announcements about our future live stream webinars. All right, take care.
Get excited.
Get excited.